I'm Dr. Jim Marsh. I am the Nolan Professor and Chair of the Department of Internal Medicine at the University of Arkansas for Medical Sciences in Little Rock, Arkansas in the U.S. This afternoon I had a presentation on testosterone in the heart, low T, high T, and how that affects cardiac function. The predominant experimental model that we used was male rats that underwent gonadectomy, and we found that, of course, when rats were castrated, the testosterone levels went down, and we were able to restore that by implanting capsules of testosterone under the skin and restored the testosterone levels in 14 days. There are a number of key findings. One is that when testosterone levels go down, the heart rate decreases. When testosterone levels come back up, cardiac hypertrophy occurs. We examined the expression of a number of proteins that regulate cardiac function, including the sodium-calcium exchanger, dihydropyridine receptor, and beta receptor, and found that all of those levels go down as testosterone levels go down, and go back up when testosterone levels are restored. Similarly, the contractile proteins, alpha-myosin and beta-myosin, their ratio alters, and their effect on cardiac contractility is altered as testosterone levels decline and as they are restored. We looked at the individual myocyte model, where we could study contractility one cell at a time, and found that with testosterone deprivation, systolic function of the single cell declined, and diastolic function also declined, and as testosterone levels recovered, both systolic and diastolic function recovered as well. We also reviewed the literature in human studies in testosterone and cardiac function, and the literature actually is very short on randomized controlled trials, but there are some interesting observational studies. One is that testosterone levels go down in patients who are sick and those who have heart failure. One observational study showed that for those that had the lowest testosterone levels in heart failure, their 3-year mortality was the highest. The testosterone levels may have just been a marker for being a sick patient, but it was of some prognostic importance. So the state of the art now is that it's intriguing that one can regulate cardiac function based on testosterone levels. At this point, there is no compelling evidence, just due to lack of well-run clinical trials, that restoring testosterone levels for those who have hypogonadism would be a useful treatment for heart failure. But it's an intriguing concept and an area that is ready for some well-done clinical studies.
Thank you very much. Very good. Now, while we're here, actually, can I ask you about the Congress, your feelings on the Congress in general?
Yes.
I mean, I've heard your views in the past, but how important is it for people in various stages of their career to attend a Congress like this?
The value of the Congress is wonderful. It's a mixture of senior investigators and junior investigators. It's a mixture of people from all over the world, and particularly in these times of international stress, it is wonderful to see people from all over get together for medical and scientific reasons. So it's really a wonderful session. All of us learn from each other. There's often very intriguing, cutting-edge presentations that really keep one thinking.
Very nice. Thank you very much.
Yep.